It's Dr. Pratit Samdani also joining us now on the next leg of the government's vaccination drive. Dr. Samdani, good morning. Tell us, now what really happens in this phase of the rollout. We've got private hospitals also joining in for the next phase. We've been reading about it, and it's that it will be available for senior citizens. Tell us a little bit more in detail, really, how the next phase is going to take place.
Good morning. Thank you again. And as we discussed this about 3-4 days ago, that the private-public partnership needs to come in. I think fortunately that's happening. I am aware that many private hospitals across the state and probably across the country are now getting equipped and getting enough stock of the vaccines. So what the common man will have to do, and the good part is we thought that this would be open for people above 60, specifically more with 60 with comorbidities, but the government has very smartly put 45 as the age and 45 plus with comorbidities. They're going to have a complete, a whole list of what a comorbidity will be qualified as. So the process will be that you will have to log on and register yourself on the CoWin app. Once you're registered on the CoWin app, you will get a notification that you have been registered, and now you are invited or eligible to go and take the vaccine. My guess will be you'll be allowed to go anywhere, any place, whether it's private or public hospital, to go and take your shot. I also do hear that the private hospitals will charge the patient or the person or the person who wants to get vaccinated. And I think the fee will be a nominal fee. And the public and the municipal hospitals, for example, in Mumbai and Maharashtra, will be giving the vaccine free, as they've been doing for the healthcare workers and the frontline workers of the last 6 weeks. So I think this is a great move. We need to speed up vaccination. That's the only way we could probably prevent a massive surge or a massive wave here onwards. So I think things should work on well.
Sure. Dr. Samdani, though, is there enough supply of the vaccine? Because, the government now lowering the age for vaccine to comorbidities from 45 age group onwards would also require a large supply of the dosages.
Yes, I think the government has taken cognizance of the fact of the past 2 or 3 months to have adequate supplies, and so that they can inoculate 45 plus with comorbidities freely. Also, please, we must remember that we have a time frame of 4 weeks and maybe more as data comes ahead between the first shot and second shot. So as manufacturing speeds up, we will have adequate vaccines. I also do hear that the Poonawalla vaccine or the Serum Institute, they are ready for upscaling the manufacturing, but storage was an issue. Now that there'll be disbursement of the vaccines from the factory, I'm sure there'll be enough vaccines all across the country.
Sure. I also wanted to understand, Dr. Samdani, for some of us Mumbaikars, as to how bad the situation it really is, given the kind of daily spike that you're seeing in COVID-19 cases, and whether or not we're on the brink of a second wave.
Oh, that's a very smart question. Well, technically, any upsurge is called a wave. So I would qualify this upsurge from the last, say, 2 months. We had the peak around September 26th, 28th, and then we had a nice sliding down. So there has been an upsurge in the last 2 weeks. And this is, if you just see from calendar point of view, it's typically when the local trains have started, when marriages are taking place in large numbers, political rallies are on the rise. So public gatherings have increased. And if we say February 1st, where the local train started, which is the lifeline of Mumbai, it perfectly fits in. The incubation period is 14 days. Today is 21st. And exactly within 15 days of public services or public trains starting in, we've had an upsurge. So the rise is there. There's no question about it. The good point, the difference between the first surge that we saw and the little surge that we are seeing now is that more patients are asymptomatic. Lesser patients are getting severe infections. And I think with people realizing the sickness that they can face with the severe COVID, they are getting medical help earlier, and hopefully they will report to the medical practitioners much earlier rather than hiding and keeping it just within themselves. So there is an increase. I'm concerned about it. I'm not worried about it. I'm not fearful about it. But I think we need to get our guards up. And we've spoken about all the precautions before. Masks up, hands down under the basin and water or under a sanitizer, and physical distances as much as possible. The government and the municipalities are stricter now. They're making sure that there are no large gatherings. They've abandoned government or political rallies. And if this continues, I'm sure they're going to take even sterner steps to probably close restaurants and public places much earlier than now.